8:14 right now, guys. A warning this morning from a local pediatrician educating parents about the dangers of giving kids opioids. Addictions could form in as little as 5 days. Kids can be exposed by a simple procedure. You know, you go to the dentist, you get a tooth pulled, and you get drugs that you think your kid needs, and maybe they don't. So we've got Dr. Milobsky here from down in Castle Rock, and
Pediatrics at the Meadows.
Pediatrics at the Meadows is the practice. Great to have you. And this is such an important topic. Kids can use opioids. There are situations where opioids are the proper prescription for kids, but not always.
Correct. So I want to be clear that as someone who practiced pediatric emergency medicine for a very long time, severe injuries, accidents, severe fractures, all of those, that's what opioids are for. And any doctor that practices in the hospital is grateful to have a powerful tool like that. But my issue that I'm trying to educate parents about is that most minor things that your teenager ends up being prescribed opioids for it's likely not necessary, or especially in the amounts that they're usually given.
Well, you know, we have a lot of parents out there watching, and I'm sure, you know, if they have teenagers, they've had minor procedures or teeth pulled, and they've gotten these opioids prescribed to them. What are the concerns? What are the long-term impacts that could be coming because of taking those drugs?
What I try to educate parents about in my practice and now, you know, nationally is that the adolescent brain is very different than the adult brain.
Yeah.
The part of the brain that drives motivation and reward, the part that releases dopamine in response to satisfying and pleasurable experiences, is very highly developed. That's why it feels great to do well on a test. That's why it feels great to, you know, accomplish something or show your competence in something new. However, the part of the brain that modulates that, the prefrontal cortex, which is about decision-making, long-term planning, is very underdeveloped. A great analogy is, think of a Ferrari with a huge engine that only has an accelerator and not a brake, and you understand how the adolescent brain functions.
Can't regulate. Correct.
Yeah. So it inherently makes them more vulnerable to the addictive properties of medicines like opioids.
Yeah.
And because most of us don't maybe even recognize or know our genetics, there could be a genetic vulnerability that you don't know about on top of that. And an adolescent misprescribed or misusing these medicines could very easily fall into a very destructive pattern way faster than an adult.
Oh, it's just scary. None of us want that for our kids. Obviously, kids who are having things done, they need pain medication. Are you suggesting there are just other safer options?
There are. There are two things with that. The first is that traditionally most physicians ask people about pain based on a pain scale. How's your pain? Is it a 3? Is it a 5? Is it a 10? I can tell you, my 16-year-old daughter has no idea what 10 out of 10 pain is. My wife does. She's had children. But my adolescent 16-year-old thinks that a stubbed toe could be a 10. Yeah. So using that is not appropriate. What you need to do is advise people that there's no expectation that your kid's going to be pain-free. Yeah. Your child should be able to function, should be able to eat, should be able to sleep, but not be pain-free. So that's exactly, that's the first step. The second step is that there's more and more studies coming out that minor injuries, even fractures, wisdom tooth extractions, the pain can be well managed without opioids at all in many people. Yeah. Ibuprofen and Tylenol, which is a lot safer. And third is, if you do need to use opioids, to have very specific guidelines and prescribe a very limited amount, no more than enough for a day or two. And then if you need more than that, you have to come back in and be seen.
A lot to talk about. We got to run. There's more on his Facebook page, guys. Check out. I'll post it on my page so you can track him down.
Pediatrics at the Meadows on Facebook and Pediatrics at the Meadows on Instagram if you want to follow my content.
There you go. Lots of good advice, lots of good things to think about, things that parents should know about. Meteorologist Greg Dutra, he's the new parent. Things that you'll have to start thinking about, Greg.
Oh, I know. Sooner rather than later, it feels